Good morning. I'm Kathy Campbell. I'm the Director of Philanthropy for St. Mary Development Corporation. On behalf of the staff of St. Mary and the seniors that we serve, we welcome you to our first annual Senior Summit. In just a few moments, we will introduce a panel of experts to discuss the issues facing the fastest growing demographic in our nation's history, seniors. More specifically, we are referring to the children born to the post-World War II era, commonly known as baby boomers. Every day, 10,000 baby boomers turn 65. Our panel discussion will focus on three specific areas as they relate to the aging population and their needs. They include housing, technology, and healthcare. Before we begin, I have the great pleasure of acknowledging our sponsors for this first event. Please join us in thanking our gold sponsor, Ohio Capital Corporation for Housing, OCCH, and our silver sponsor, MVAH Partners LLC, for their support of this event. St. Mary Development has partnered with OCCH on 21 different housing projects and with MVAH on 46 housing projects. Both organizations are great supporters of affordable senior housing, and we are honored to have their support today. Please join me in thanking them for their support. We are also grateful for our partnership with Don Baker, the publisher of the Dayton Business Journal, and his staff for this special event opportunity. This event has provided us with a forum to bring together community leaders and business leaders, as well as those who are already engaged in serving the needs of seniors. We believe this open conversation is vital to addressing the issues facing seniors today and in the future. Our moderator today is Caleb Stevens, the editor-in-chief for the Dayton Business Journal. He will begin by briefly reviewing the format for this morning and how you as an audience can participate by submitting questions to the panel. At this time, I invite Caleb Stevens to take over and introduce our panelists. Thank you.
Thanks, Kathy. Good morning, everyone. As Kathy mentioned, there are pieces of paper on the table, so if there's questions, please write those down. I'll be walking around during the Q&A session, and then at the end of the program, there also will be time for audience questions. But to kick things off, let's introduce this great panel here. We'll go left to right, starting with Kate de Medeiros. Kate is an associate professor of gerontology in the Department of Gerontology at Miami University. She was the principal investigator on the research study and assessment of information and service needs of people 60 plus in 4 Ohio communities: Centerville, Dayton, Huber Heights, and Kettering. Welcome, Kate.
Thank you.
Next up, we have Scott Collins. Scott is president and CEO of LeadingAge, a research firm specializing in the senior market and emerging technologies. He also is a founding member of the Family Caregiver Council, an organization that provides support and resources so caregivers won't become overwhelmed. Welcome, Scott.
Thank you.
Then we have Kathryn Brode. Kathryn is president and CEO of LeadingAge Ohio, a nonprofit trade association that represents 400 long-term care organizations and hospices, as well as organizations providing ancillary health care and housing services in more than 150 Ohio towns and cities. Member organizations serve an estimated 400,000 elderly Ohioans annually, including many in the Miami Valley. Welcome, Kathryn. And lastly, we have Tim Bete. Tim is president of St. Mary's Development Corporation, a faith-based nonprofit that has developed 60 affordable housing projects with more than 4,000 units, especially for seniors. St. Mary also provides service coordination to connect its senior residents to services that allow them to remain living independently for as long as possible. Welcome, Tim. All right, well, kicking things off, Tim, we will start with you. Why did St. Mary Development decide to host this event?
Thanks, Caleb. St. Mary's has been tracking senior trends, especially in the Dayton area, for a long time. And most recently, we worked with Bowen National Research, a research company out of Columbus, to do a study of local seniors. And we looked at 4 counties. We looked at Montgomery County, Greene, Clark, and Miami. And just to give you an indication of the senior population in those areas, the overall population has remained pretty flat and is predicted to continue to be pretty flat. But between 2010 and 2020, the senior population 65 and up has increased from 15% of the population to 20%. But 31% of all households will have a senior in them. So we're really seeing a pretty significant change. That senior group is the only age cohort that's seeing growth. Most of the other age cohorts are actually seeing some decline. At the same time, our data shows that in 2020, 38% of all seniors will have incomes less than $30,000 a year. And what that means is when it comes to paying for housing, healthcare, transportation, there's not going to be a lot of money left over after that. Most of these seniors, or at least the majority, will be living only off Social Security. And just to give you as an example, in our affordable senior apartments, our average income is about $12,500 a year, with 92% of our seniors living solely off Social Security. So we're seeing on both ends of the spectrum, the income spectrum, there are opportunities. 16% of seniors will be making over $100,000. So there are opportunities, but there's a huge mass of seniors who have these lower fixed incomes. And we think that connecting them to affordable housing, to healthcare, and how technology bridges the two is really going to be critical for our local communities. The cost to communities of not taking care of seniors is astronomical. And so our hope today, we want to have this event to start a conversation that we hope will be ongoing, where we can talk about not only how do we improve the quality of life of seniors, but how do we do that in a cost-effective way that's affordable for our communities.
Very good. Let's go, Scott and Kathryn. We'll start with Kathryn. What is the top issue facing seniors these days?
Well, you just heard Tim touch on it, and he spoke about the costs that we are seeing even now and the incomes that we have now. But I think I'd like to frame my comments with a question to all of you. How many of you have life insurance? Look around, see all the hands. And how many of you have put in place some sort of long-term care insurance? Much fewer number of hands, but I'm thrilled to see the hands that I did. Yeah. That is exciting that that group of you have thought about long-term care. And what I see and what our association sees as the most important issue right now is that the demographics that you just heard Tim describe don't rise to the level of importance and concern that they should. So Americans aren't planning for their long-term care. If you've had a parent have to navigate long-term care issues, you are far more likely to think about this issue. But the average American can look forward to long-term care costs. Women, we're going to have higher costs than men because we will be living longer or expected to live longer, but of about $180,000. You've got a 1 in 10 chance of having expenses less than $10,000. So you can roll the dice and hope that's one of you. You also have women about a 12% chance of having costs in excess of $250,000. You might have chronic care needs that put you in that bucket. But the general average number is $150,000 for a woman. And when you compare that to what you just heard Tim say in terms of average income, you see the gap and you see the concern. So we have housing that we know has a nexus to healthcare, and we know that we need to have housing and affordable housing for individuals as they age, but they also need to be planning. And we really believe that that is the most important place where our heads need to be today, both from a personal perspective, which was my plea to all of you just then, but also from a public perspective. And we know from the state Medicaid budget that when it comes to having our public resources pay for these needs, it's going to be astronomical. And the tension and the stretch on the government dollar to meet the needs of an aging demographic are going to be challenged incredibly, as we need to have those same resources for education. So the important need of having a strategy for us as a state, as a city, and personally for long-term care is critical.
Scott?
Sure. I think Tim and Kathryn just framed it about as well as it can be framed. I'll add another word: connectedness. We know that seniors increasingly experience social isolation, and when that begins to happen, all types of other negative consequences result from that. Conversely, when there is connectivity from a social standpoint, it can improve recovery times from major surgery, lead to longer life expectancy, and improvements in the quality of life. So there's the connectedness component, but then another piece of that is really what we're seeing is a precipitous decline in the number of family caregivers today and going into the future. And as big a challenge as that is here in the U.S., it's not just our challenge alone. We're seeing that globally, particularly in Asia. And the net impact of that economically, the total value of unreimbursed caregiver today in the United States from family and informal caregivers is roughly $500 billion. So because people waited longer to have children or having less of them, there's not only less connectedness, but less family caregivers to go around. And when we combine that with the challenges we're facing in healthcare, recruiting, retaining, incentivizing caregivers, it really speaks to a massive challenge. So there's the connectedness component, the family caregiver piece, and then I'm really glad that both Tim and Kathryn highlighted the financial resources in our aging community. You know, for most of their adult lives, marketers have salivated over boomers. Now that they're becoming seniors, we know that roughly 2/3 of them have net assets of less than $50,000. So when you begin to look at the longevity bonus, that benefit that accrues from having a longer life expectancy, the challenge facing that is that we don't have the resources. People aren't planning for retirement, don't have long-term care insurance. And so the idea of retiring at age 65 and living for another 25 years or so without the means to do so represents a very, very significant issue for our society.
Thanks. Kate, let's move on to you. We had talked before the event started about your research with seniors in Centerville, Dayton, Huber Heights, and Kettering. What did your research show are some of the biggest issues facing seniors in this region?
So to put it in context, what we did a qualitative study. So we did focus groups with a lot of different stakeholders in those 4 communities, as well as older persons themselves. So we talked to people 65 and over, we talked to volunteers, information providers, first responders, and others. And so there were a couple big things that came out which are not different than other communities in the US and really in other places around the world. Transportation is a huge issue on many, many levels. So there's first the ability to get from point A to point B, which depending on where you live, there might be different challenges. We heard people talk about how the signs for buses, for example, are on with a gray background with black typeface, which is really difficult to read for aging eyes. The bus schedules are available online, but if you don't have access to the internet, you can't access those. If you call the number and you have a subsidized phone and you are put on hold, then that means that you might have to make a choice between finding out what the bus schedule is or calling your doctor or somebody else. There might not be a safe place to wait for the bus. There might not be a covered area. There might not be a crosswalk. So even if you get beyond just the bus, think about Uber. Okay, so maybe you have enough money for Uber or a taxi, but the increasing number of people who live alone, a phenomenon, of course, in countrywide, a lot of times you need to have somebody with you for a procedure, so colonoscopy, maybe you're having your eyes dilated. So, there are all these challenges that come from something just like transportation. And even, again, programs that might offer, say, rides to physicians, sometimes they pick you up 4 hours early, and then you have to wait, and there's no place to wait. Or maybe you have to wait 4 hours after your appointment. So transportation is a problem, I think, that all communities face. A second thing is that there's an over-reliance on the assumption that family is a part of a person's life. A lot of people we talk to, and regardless of socioeconomic status, didn't want their family involved. In fact, that led to an over-reliance on first responders for things that first responders really didn't need to be doing because of the fear of being removed from their houses. So we saw people calling first responders for minor things that weren't emergencies because people needed something else, but they didn't want their children to become involved because they were afraid that they were going to be put in a nursing home. I mean, the fear of relocation and losing one's home could lead to a lot of things. And then families often weren't people that were perceived as folks they could trust. So we heard a lot of things about, grandchildren and taking medications or, strained relationships. So that idea that family will be there is something that, in fact, when one focus group, much to the chagrin of my students, the students had asked, well, what about family? And the focus group burst into laughter and said, oh yeah, that's a great one, ha ha. And my students said, well, what is that? And it's that assumption. And then the social isolation thing can't be overemphasized. So again, people living alone, even in large retirement communities. We had one person say the phrase, we're living in a pre-graveyard, because the lack of opportunities to engage in something meaningful, and really for the folks there, it was to get out. For all the transportation reasons. So they felt like they were living in this large place with a lot of other people who were over, 55, but they had no reason to ever connect with each other, and they just kind of sat there and waited for time to pass by. So those were the really big things that came out of that. And again, when we looked at other needs assessments that were done in other major cities across the country, there were very similar findings. So health is a really important issue, obviously, but aside from that, there are all of these other things that feed into that, as the other panelists have mentioned.
Thank you. Tim, let's go back to you. What are housing trends that you're seeing in the Dayton region right now?
Well, there's actually quite a few of them. One of the biggest ones is the existing housing stock is old. So more than half of the existing housing stock was built before 1970. How does that impact seniors? Well, if you're a senior homeowner, that means you're probably not going to you're going to have higher utility costs, you're going to have more repairs and maintenance on the home, which might be difficult for you to handle. And there's really a significant need for additional affordable rental housing. Sometimes seniors want to move out of their home, different reasons. It could be the maintenance costs, but it could be they want to live with other seniors. It could be because an apartment is more accessible. Maybe it's easier to get around in a wheelchair or a walker. Maybe they just want to downsize. But at some point in their life, we're seeing more and more seniors move to the rental side. Now, here's a kind of an amazing statistic. For senior renters in 2022, 66% will have incomes less than $30,000. So affordability for those people is key. That's 2/3 of the senior population who are renters. Now, there are some renters that will have higher incomes, but only 7% will have incomes over $75,000. So really, from the rental side, we're dealing with low to moderate incomes for almost all of those seniors. Another trend is that many seniors are house cost burdened. And what that means is that they're spending more than 30% of their income on housing, which typically has a ripple effect. Now I can't afford transportation or food or healthcare or other things like that. So In the four-county area that we looked at, more than half of the seniors are housing cost burdened. So that's pretty significant. But here's the really amazing thing to me. Nearly 25% of senior home owners are housing cost burdened. And you might think, well, by that time they've paid off their mortgage and other things, but that's often not the case. So if you own a home and your income is less than $30,000 a year, your ability to do upkeep, pay your taxes, and things like that are significantly curtailed. Again, focusing on the senior homeowners, by 2022, 30% of those homeowners will have incomes less than $30,000. So it's really a big deal. Even if you jump up to $50,000 incomes, 50,000 and below will be half of all senior homeowners. So these are people that, as long as they were working, they did fine. They were able to kind of get by. But now they have an asset that sometimes they're counting on to pay for their retirement in the long term that they can't keep up. And we get calls all the time from seniors who say that. They say, I don't have a mortgage, but I also can't afford to replace the roof. So what do I do? Now, for senior homeowners, on the other hand, 32% will have incomes over $75,000. So we're seeing kind of markets on both sides, but there's not a lot in the middle. It seems like you're going to the low to moderate side or a more affluent side. But the biggest number by far is going to be on that low side.
Kathryn, speaking of where to stay, is assisted living, is that an option for most seniors?
Well, let me start that question by piggybacking on what Tim just said, and we can have a very structured conversation about what options are, but what an individual wants is something different. And if many of you have family members like I do, leaving that home that you have worked for all these years is very difficult. And I know I've heard this quote at least 100 times over my career. You're going to take me out of this home in a box. I've worked for it and I love it and I want to stay in it, even though the roof is having issues, and even though lots of other challenges, transportation and isolation. And so understanding what is the best option is a challenge that this is gonna sound like a repeat phrase from me, requires planning, making sure that you've had discussions, making sure you understand the implications of remaining in the status quo, making sure you understand the isolation that is occurring, whether it's in your own planning or helping a loved one. I had a recent experience with my own mother who is living in a retirement community, and my parents were in a home in a suburb, and as they aged, they stopped driving at night. As they aged, well, they didn't drive when it was raining out. Roads might be slippery. Then they didn't drive, it might be icy. So their world became smaller and smaller and smaller. And so the choices are very important to understand when you choose to stay home. Well, to your question, what about assisted living? And assisted living is an option, and you probably have an assisted living facility within a mile of your home, probably. They proliferated greatly. But the cost of assisted living, with what you just heard in the income that Tim described, is approximately $41,000 a year. So that is an individual living, think about a couple on that income, that household income that Tim just described, and you see the challenge of having one individual in the home and the other individual in assisted living. And then the challenge of the one in the home getting to the assisted living with all the transportation issues that Kate described. So assisted living is a viable option for those with resources. In the state of Ohio, we have assisted living waiver, and that is the ability for an individual with low income to receive assisted living services through Medicare waiver. That means they're institutional level of care qualified, but they're receiving the care in assisted living. That's a very low-paying rate for a provider. And so it's difficult for providers of long-term care to offer that. As a result, there's a access issue to assisted living for low-income individuals. And likely, if they're living in an affordable housing unit and they end up needing assisted living, it's going to be very difficult to find that. They are more likely going to end up in long-term care. So assisted living for those with resources, very available. Assisted living, even with dementia, much more focused assisted living available now, but assisted living for those with low income, much more challenging.
Along those lines, Scott, how do you see technology allowing housing to become more of a platform for these healthcare services?
Sure. First of all, technology is great. In addition to our research, we also have 2 private equity funds that invest in early stage businesses with products, services, and technology, all focused on older adults and healthcare. It is an enabler. It is not a replacement. So in terms of using the home as a platform for technology, absolutely. A couple of things to remember though. Affordability, so making sure that the home is wired for whatever type of technology solution that you're looking to implement, so high-speed internet access, Wi-Fi, so on. You got access, you've got affordability, and then awareness. And that's the other piece. We can talk about all these great technologies that enable people to stay in their own home longer, but the awareness component to that is really problematic. Most older adults are not aware of the different suites of technology solutions that are available to help them stay independently, help them stay connected, and help them stay thriving for as long as possible. So all that being said, wireless is critical, but then there are a number of different technologies that can be used and layered on top of that. So the connected home technology that most of you are familiar with has tremendous applicability for older adults. What we're seeing in terms of user interface, voice-first technology, so Google Home, Alexa, things like that, where you can actually speak and engage, is leapfrogging other types of user interfaces at a pace that we have not seen previously. So we're seeing much greater adoption. From a pure healthcare standpoint, we're starting to see virtual care, telehealth be increasingly important tools to have in that technology toolkit, although, and Kathryn is very well versed on this, from a public policy standpoint, reimbursement is not there for those services, for providers to deliver those, particularly in urban settings. So if you live in a very rural community, telehealth is probably going to be available for you and can be paid for by the government, but not if you live in a city. Beyond that, there's a lot of other different types of technology that can provide that connectivity to the outside world, again, to help begin reducing the risk of social isolation. Tablet technology, like a company called Breezy, who uses a Samsung tablet, but they've taken the user interface and operating system off completely and rebuilt it and redesigned it specifically for older adults. So think about it from the standpoint of usability. It can connect different Bluetooth devices, so you can monitor weight, blood pressure, pulse oximetry, diabetes, and so forth. But they're Bluetooth connected. Imagine trying to explain to an 87-year-old with early onset of dementia how to repair Bluetooth devices to that tablet. What Breezy does is automatically repairs everything. If it senses that it's disconnected, it puts it back together. In addition to that, it's a great portal. It comes preloaded with all the contact information, so you don't have to remember passwords or set up Facebook. So if you have a grandchild that you want to Skype with, you just press a picture of them. If they want to connect via Snapchat or Facebook or Instagram, it's all very simple and easy to use and very intuitive. Finally, I would talk about a company called Great Call. Quick show of hands, how many people have ever heard of the Jitterbug phone? Right? Okay, Great Call is the one that developed that. They've moved far beyond that technology of just big numbers on a cell phone. They use smartphones in their suite of services, but they've also incorporated a lot of other technology like Lively Mobile, which is one of the best mobile personal emergency response products out on the marketplace today. They have a 5-star system so that instead of having to call emergency responders for everything, which is a huge issue, they can reach out and contact Lively Mobile and talk to their service coordinators and things like that. So there's a lot of other tools and devices out there from a technology perspective that can help people stay in their home longer and more independently.
Thank you. A reminder, if anyone has a question they've wrote down, just raise your hand up and I can come around and get that. Shifting gears a little bit, Kate, we're focused on the seniors, but caring for seniors involves a lot more than that. So what are the greatest issues facing families who are taking care of a senior?
Well, I think there are a lot of issues. One, of course, that many of you probably are experiencing is working and caring for, say, an older parent or an older family member, and whether that person lives nearby, which now it's very unlikely that you might live near a parent who you might be caring for. There's been a lot of research by AARP and others that suggests that even though individuals may be able to take time off for family care, few people do, because they don't want to be perceived as, somehow not pulling their weight, or they don't want to be identified as somebody who may, not be available. So, we see a lot of burden from people who are working, caring for an older family member, and really not taking advantage of caregiver leave if that's even available. The second thing is I'm sure, as you all know, that caring for an older parent, the hands-on care tends to be involved with women caregivers. I mean, there are certainly a lot of male caregivers, and I can talk a little more about that, but the hands-on care is generally delivered by women, whether it's through paid caregiving or through non-paid caregiving. So women who also have the advantage of living long and having more chronic diseases and far fewer resources financially, and then caregiving added on top of that adds on to that whole cascade of events. Women also tend to live alone, older women, and live in more poverty. So you have this culmination of things that can affect caregiving. Now, for men, a lot of men who want to be caregivers feel that they're not adequately prepared. So depending on your age and the generation that you grew up in, you might not have been enculturated to care through child rearing or other things. So there's challenges for men who do want to be those hands-on caregivers in simply not knowing what to do. And there are some research that suggests that hospital staff have a certain bias. If you come in with your, if you're a daughter and you come in with your father and he needs care, or your mother, then they assume that you'll be the caregiver. But if you're the son, they will help you find a place to put that older parent. So we have to think about some of those issues. But overall, caregiver burden is a big issue. Caregivers get isolated. Caregivers suffer disproportionate rates of depression because of the social isolation, and really don't get the respite that they need. So it's a huge health issue for people who are being those providers of care.
Can I just add to that?
Please.
It's a huge issue for employers also. The MetLife Mature Market Institute did research on this several years ago, and it picks up exactly on what Kate was saying. They wanted to measure the impact and cost of caregiving to the employer, and the way they measured it was the cost of employees coming in late, leaving early, something called presenteeism, so they're at their desk but they're really searching for answers online or making phone calls, and then finally turnover, getting to the point where they can no longer provide that care and work a full-time job. The cost at that point, this goes back to 2011, was $4,000 per full-time employee per year is the cost of caregiving and the burden that is taken on by the employer, which also speaks to an incredible opportunity employers have to incorporate solutions and resources for their employees to help them be more productive, to combat things like the negative health outcomes that occur when a caregiver is providing care and getting sicker than the person for whom they're providing that care.
Let's keep talking about the caregiver, because a lot of people in the questions I've kind of gleaned at so far are looking at, well, what are some of the solutions to these issues? And so for the caregiver, are there technology solutions being developed to help out with this issue?
Yeah. About 6 years ago, a group of us in the industry really wanted to put together a curated set of resources that would be available online to caregivers, because one of the challenges is you never know when that job is going to start. For me personally, it was last summer. My mom contacted me and said that the doctor told her she had to have both legs amputated at the knee because of vein problems, which I thought sounded wrong, and it turned out to be. And I had spent years with some of the best thinkers in this business putting together this curated set of resources. FamilyCaregiverCouncil.com, if you want to look it up, and it's got all kinds of great information and links to technology and services and so forth. I had the moment of, oh my gosh, now what do I do? And so then I remembered that I was part of this group and I should probably go to the website. But two things I want to highlight. One, a company called CareLinks, because I live in Cincinnati, my mom lives in Boca Raton, Florida. She doesn't have any other family down there. What CareLinks does is has a network of fully vetted, screened professional caregivers, hundreds of thousands, that are independent, but they have a 5-star rating system, much like you would see with Uber and so forth, full background checks, fully vetted and screened appropriately. So I contacted them, told them what the issues were, how many days a week my mom would need service, and they helped me put together a resume that was posted online, and within 3 hours I had 11 applicants. And beyond that, something that people don't recognize is that when you are arranging for those services, you also have to pay for those services, do the appropriate withholdings and so forth. They have a secure portal so that what you see is the net cost to you. So if it's $22 an hour, the benefit is there's not an agency sitting in the middle of that, so those workers are actually earning more so they can get a higher quality worker. They also will help you interview, because I said, look, I've never interviewed caregivers in my life. So they'll help you interview them, set up all the screening questions. It was a phenomenal service. Beyond that, as I mentioned earlier, great call, and the Lively mobile assistive device. Got that for my mom, and it was excellent. Turns out she did not have to have her legs amputated, thank God. But beyond that, there is a lot of other resourcing out there. Everybody talks about Uber, I think just because it comes top of mind quicker. Actually, Lyft has been doing a tremendous amount of research and engagement into the senior space over the last 3 or 4 years. And I think they are really starting to look at that door-through-door service concept. So to Kate's point earlier, it's not enough for the person to show up at your front door and wait for you to come out. If people need assistance both at the front end of the ride, the back end of the ride, and in the middle, Lyft is working very hard to figure that out and make it affordable.
Moving on to more solutions. Tim, what innovative housing solutions are you seeing that also can help seniors?
There's really 2 areas that we see. One gets to this issue that we've all been talking about who you live with, who can help you. Is it family members? Is it friends and others? And the other has to do with kind of more the physical housing. So regarding living arrangements, not as much in this area, but especially in other countries and other parts of this country, we're seeing more intergenerational programs. So college students, for instance, living with seniors in return for free room and board, helping to take care of the house, helping with transportation and other things. There's a senior property independent living in Cleveland that does that with Case Western Reserve, where the music students live there for free, and in return, they give musical performances. And so you get this kind of help. The seniors don't feel as isolated as they might. So there's that area, but I don't see us doing quite as much of that locally. And then there's those family shared living arrangements. And while on one hand, we've seen families kind of fall apart a little bit, and as Kate said, the family members sometimes are as much of a problem as a solution. And in 2000, 15% of the U.S. lived in a multi-generational household. And in 2016, that had increased to 20%. So we're almost back to levels from 1950. Now, a lot of that I don't think has to do with wanting to take care of seniors. It has to do with economic reasons. Sometimes the kids need the grandma to move back in to help take care of the grandkids. It's financial reasons. We've seen seniors in our affordable properties move out to live with their children so the children's house wouldn't be foreclosed on. They needed the finances. Not something the senior really wanted, but we're seeing those kind of forced relationships. It's hard to tell whether that's a benefit or not. They might be in the same home and not helping out, but it's certainly at least a trend. On the design side, there's two things that we see nationally, and especially on the coast where housing is more expensive. So one is in-law suites. So if you, one of the issues, transportation issues, is if you're taking care of a parent and that parent lives 20 minutes away from you, that's a lot of back and forth. It's certainly much more convenient if they're living close by. So once they're in there, people looking at, well, how can I change my house to give them some privacy? There are companies out there, for instance, that will take a 2-car garage, turn it into an apartment for you, and so that they can kind of have some separation there. The other one is what I call tiny cottages, and some people call these granny pods, where it's actually not attached to the house. It's a prefab house that's fully wired and has a shower and everything in it, but goes in the backyard. And while there are a lot of zoning issues around that, where in places like San Francisco and some big cities, we're seeing more and more of that. So it's giving them, the seniors, a place to live that's hopefully close to the help that they need, so that you're at least not having that drive time every day.
A lot of questions have come in on the issue of social isolation, and you talked about the music students helping out, but obviously it's what are some things that can be done to prevent this, or at least alleviate social isolation for seniors? Kathryn, do you want to start? We'll pass it on to Kate afterwards.
Sure. There are several ways to think about this. There's the individual who is living in their home, and back to my comment that they're not going to leave their home, and what can we be doing to increase their engagement? And there are several examples around the country of organizations that have used technology to engage with those that they serve through services into the community. So they're two-way conversations. It's not just receiving information about how that senior is functioning. We have technology that can basically track an individual's movements within their apartment. It can track when the toilet has flushed, if somebody has gotten out of their bed, if they've moved into the kitchen, opened the refrigerator door. Things that reflect the fact that there's movement, anticipated movement, and can, in some ways, even predict problems. How many times that toilet is flushing a night can be an indicator of an infection, a urinary tract infection. So there are ways in which you can receive information, but that doesn't tackle the social isolation problem. And so some of these organizations have created a way by which they are engaging with the individual. And one of my favorite examples is actually unrelated to technology at all. And it was a small town in Maine that used their 911 call center to check in on individuals who they perceived were at risk. And every morning at a time of day, which they concluded was a relatively slow time for that city, they asked these individuals who were homebound to check in. And if they didn't receive the check-in call, then the first responders would be sent. Well, what they learned over time, and it's a fascinating story on NPR if you want to hear it, is those calls weren't just, "Hi, Joe, I'm up and I'm fine." It began to be the building of a relationship between those who were in their homes and this person that was sitting in the 911 dispatch office. What the individual in the home needed and wanted was the opportunity to engage in a conversation, not just say, "I'm alive this morning." And so some of the organizations around the country are using that, using their technology to every day engage with an individual on a different question. And in fact, they are becoming sort of the eyes and ears into the home, because we can have lots of ways in which an individual can communicate with us, but somebody really needs to be asking pertinent questions in order to get at what's happening in terms of changes in conditions. So I think that technology is increasing, but it's reliant upon a platform that engages in a way that provides personal response to the individual. So that's one example. Scott probably has a gazillion, given what he does, or Kate, yeah.
Kate, we'll start with you.
So my perspective is a little different in that most of my research I spend talking with older people about a variety of things. So I've probably talked to 1,000 people over my career about what it means to be old, what it feels like, what some of their concerns are. And I can tell you that I think a big misconception about social isolation is, building on your point, Kathryn, is that contact equals, solves problem of isolation. And the biggest problem that people talk about is finding meaning. So you have time, but if your time doesn't mean anything, if you're simply busy, if you're going through routines and nothing means anything, that's wherein lies the big problem. So yes, having contact with other people is great, but it's not the same as engaging in a way that makes your life worthwhile. So when we think about, especially technologies, I think we have to be careful in that assumptions about, say, Skyping, may or may not be that fulfilling thing. A second caveat is, going back to families, is right now it's estimated that 20% of women over 65 in the U.S. do not have children, somewhere around 13% for men, although it's harder, the data on men isn't as reliable. That number is expected to increase. So again, when we think about how we get people engaged, we have to think about the fact that many people, don't have children or families, and that they're looking to engage in meaningful ways. And again, coming back to the study that we did in this area, even people in high rises. So, the people might say, some of the staff might say, well, we have things, we post things, and nobody ever comes. But when you talk to the residents who live there, they say, well, because I don't want to just sit there and be talked to or lectured at, or, I want to meet people, but I'm afraid to get involved and reach out too much, because what if I get in an argument with my neighbor and then I have to live by that person forever? And so finding ways to get people together in ways that make people feel safe and that they're not just doing an activity, but that they're doing something meaningful, and getting out of the place that they live, being able to go to the art museum to see an exhibit, being able to do something that, allows them to do something that's meaningful for them. And I think that's just a big thing that needs to be considered when thinking about isolation, is what is meaningful for that individual. So it's the doing with and not just the doing for.
Some audience questions. Tim, we are a business journal, so what are some business opportunities for-profit businesses in the region around this topic?
Well, I think we've heard a lot of them. It's with the population base of seniors being so large, and just to get back to seniors being isolated, by 2022, 40% of seniors in this area will live alone. So you have all of those issues. But I think we're going to see some real game changers, kind of the way that you look at Uber disrupting taxi, or the way that Amazon disrupted local retail. So one of the big things that we see is home delivery. So it used to be, when we built an apartment building, we wanted to make sure, how is it walking distance to things? We have some properties up in Iowa, senior properties, and I was up there talking to them. One's a town of only 5,000 people. Almost every store will deliver to them. Well, that's a big deal, and not just for getting the things, but then they talk to the delivery person. There's kind of those interactions. And so I think when businesses look at what they do now and look at this changing demographic, they really have to rethink what they do. If you own a restaurant, for instance, and most of your regulars are getting older, are they going to still be able to come and be regulars at your restaurant? If you don't deliver, are you going to just lose them altogether? Because these are people that, while they were working, their incomes were a lot higher. Most of the people that live in our affordable housing, they weren't poor all their lives. They did great. They owned homes, they raised families. But the day they stopped working because they weren't able to save for retirement, now they're living off Social Security. So this is a whole new thing for them. I think where the real business opportunities are the money in the healthcare system. So we're spending huge amounts of money on these people that we don't often calculate. It might be the cost of having an EMT visit a resident. We had a resident who called an ambulance 10 times in 1 month. Sometimes they'll call the ambulance because they're lonely. well, what's the cost of that? We're already paying for some of these things. We're paying for the health care. So there's money in the system. And I think as we see the federal government especially look at what are more effective ways to serve seniors, we can actually come up with higher quality solutions at a much lower cost than we're currently paying. But it's going to be, it's not going to be just tweaking existing businesses. Some of the things that Scott is talking about, it's going to be a wholesale change in the way we serve seniors.
I'd just like to pick
Sure.
up on something you said, Tim, and give a real life example with this idea of EMTs becoming, almost like social service coordinators. In Upper Arlington, there's a senior living provider, National Church Residences, who saw this phenomenon. EMTs going out on repeat call after repeat call after repeat call to an older adult's home when it wasn't truly an emergency situation. So what they did is at their own expense, they put a service coordinator actually in the firehouse. And when there was a call from an older adult, the service coordinator would go out with the EMT squad, and instead of it turning into an admission through the emergency room, they actually triaged and said, okay, what are we really here for? What are the services that you really need? And let's help coordinate that for you. It resulted in an 85% reduction in repeat calls, but actually got the older adult connected to the appropriate resources that they needed for whatever challenges it was that they were facing. They've done that in Upper Arlington, and I think they've done it in South Central Ohio as well.
And there's some testing locally in doing that. Because the funny thing is, the residents, the seniors, they know the EMTs because they're in the buildings all the time, if it's a multifamily building. So they trust them and talk to them. So for them to come in and even do some of this preventative care, they're already medical professionals. We're already paying for them as community, so it's a great solution.
And I'll piggyback on that. In the state of Ohio, the number of 85-year-olds and up is expected to triple in the next 25 years. So when we talk about this example that Scott just gave, they're not responding to 60 and 65-year-olds. They're responding to 80, 85-year-olds and 90-year-olds. And I really believe that there's a business opportunity in finding a way to take the care coordination model that you heard Scott describe and actually remove him from the middle of it, because he still had to think about whether that next caregiver arrived, right? And having someone who's really, or having a product that removes from the family the fear that that caregiver isn't going to have the shift change occur in a way that's successful, and really is thinking through what is needed across every silo that we have. And when I say silo, what I mean by that is you can live in a nursing home, or you can live in assisted living, or you can live in affordable housing. Those are all silos that are paid or receive revenues in a different way. Someone that stands above the silo, some product, some way in which to see across all the options and decide not on the basis of the revenue stream that comes from each of them, but on the basis of what the individual needs and would best be served by. That, if somebody can solve that nut, and in a business model that's affordable, it's just a tremendous opportunity.
Well, the cost savings are real there. So in our affordable properties, we have service coordinators who kind of play that role where you can go to them with any issue. I need legal help. I don't understand my Medicaid bill, or I need a new primary care physician. And so we're kind of playing that role now. The cost savings there are kind of ridiculously high because these people can't afford assisted living. So for every month we keep somebody living in affordable housing, it saves taxpayers $4,200 a month. But their funding streams don't work right, so we can't fund those service coordinators. And that's a key thing, even with the technology. Having a body there, somebody can help you navigate through these things, because I can't understand my own health care. You probably can't. We can't do our own taxes anymore. So how are we going to expect somebody who's their eyesight's failing and they have early onset dementia to do something like that? And so our service coordinators, in a way, play the role that the family used to. They're there to help kind of connect them and to make sure, especially during those transition times when you come back from the hospital or your insurance plan changes, what do you do?
Just a last quick point. To add to this, people living in their own homes, though, have such a fear, again, of going to a nursing home that the first responders in this area told me that since firefighters especially are the most trusted profession in the country, and they know that firefighters won't file a report say like a police officer might be obligated to, that they'll call the firefighters because they don't want to leave. And so there's a point of educating people also that they're not going to be ripped out of their homes. You know, it's okay to talk to a service coordinator. You're not going to, be hauled off to a nursing home dungeon, in the dead of night. And that seems to be the fear that keeps driving at least the people living in their own homes from the EMT use.
All right, we have another audience question here. What single piece of advice would you give to 30 or 40-year-olds to prepare for their parents or loved ones aging? Throw it out there. Who wants to jump in?
I will say I get asked this all the time whenever anybody finds out I'm a gerontologist, what do I do about my parents? And, I'm sure you all would agree that, educating yourself on even what's out there, nobody knows who to call, and as we all know, it's always a crisis situation. So people don't know about area agencies on aging or things like that. So obviously educating yourself prior to a crisis situation, knowing, what services are available and what your options are, you can never start too young to make yourself acquainted with those.
And I'll go back to the story that I told about my parents and having their world get smaller and smaller. They knew that the house was becoming too much for them. And I will never forget my mother calling and saying, I came home from an errand and found your father on the roof cleaning the gutters. My father was 79 years old and had broken his back several years earlier. And so when we talked about what options they might like to consider, my father was the I'm never going to leave my house kind of guy. And part of the concern was the cost. And we sat down, and it was an aha moment for him when he understood how much money he was spending on the house and compared that to what it would cost to move to a retirement community in Delaware, Ohio was where they moved. And it was remarkably similar. But in his mind, before he did that math, it was way too expensive because they didn't have a mortgage anymore. It had been paid off. But he wasn't considering all that he was paying in property taxes. He had figured out after my mother put out that SOS that he needed to have somebody else clean the gutters. And so he was beginning to see that he had to pay others to come and provide services. And when you did that math, it made sense. So I think having a conversation that speaks to options, speaks to how do you want to age? What does it look like for you to age in a way that is successful? And try to move the conversation away from this is what I've always known. Remember, if Ford had done what people wanted, it would have been to deliver a faster horse. And so, to sit down and say, really talk to me about what it looks like to age successfully. And if it's, well, I'm going to be able to drive and do what I want, let's plan. In fact, we have a leadership program at LeadingAge Ohio, and one of the fellows has as her project to encourage the conversation when you can no longer drive. Not if you can no longer drive, but when you can no longer drive, what are your options? Uber, Lyft, think about all the possibilities, but couch the conversation in when you age, not if you age. No, it's when you age and when you move into an area in your life when you can no longer perhaps have the kind of abilities that you have right now. What would it look like to be truly successful and aging well? And I would have that same 30, 40-year-old answer the same question for themselves, even at that young age. So don't just see it as something for 30 years from now, but think about it now and think about all the health habits that you can adopt now to age well. So that's just, I'll get off my soapbox now, but.
We've had a couple questions about cybersecurity as seniors may be more vulnerable to attacks of some such, especially if they have safe homes. Are there systems in place that can prevent those securities from being hacked?
$37 billion a year. That's the amount of financial fraud that takes place for people over the age of 65 in this country. It is a massive challenge, especially as everything starts to become more and more electronic. So previously it was just about somebody making repeat phone calls to someone with dementia or Alzheimer's and getting them to donate to some phantom charity. There's a company out there called TrueLink Financial that has created a technology tied to a credit card that provides guardrails for older adults and their family members so they can set the tolerances on how the money is dispersed, to whom it's dispersed, trusted, third parties and things like that, which has made a pretty big impact in a very short period of time in improving the financial security of older adults. From another aspect of health information and things like that, that's the one area I had mentioned earlier about voice-first technology that is still a fear among some older adults that we've spoken with. It's, okay, so I'm talking into this thing, but is there a risk that they're going to have access to all my, health information and things like that? And the answer is, yeah, there is. Younger adults, as they age, they're really comfortable sharing stuff that everybody my age tried desperately to keep secret. So I think as the millennials and Gen X and Gen Y start to age, I'm not sure that concern will be quite as significant, but for older adults it is, and they're valid concerns.
If you're a business that requires individuals to pay via credit card, I'd really encourage you to change that policy. And what I mean by that, I didn't explain that well. Some health systems will reach out to individuals in advance to cover co-pays prior to arriving for the visit. And my mother received a call from her insurer asking her to pay in advance so that it could streamline her arrival at the office. Stop that practice. That really isn't a practice that helps seniors. We are trying to encourage them never give your credit card out over the phone, and we have businesses that are calling and saying, we'd like to streamline your arrival by giving your credit card number over the phone. I really encourage that to stop. It's still happening, and that's one very small step that we can take to bring, it's not cyber related at all, it's just simply a policy. And as of September 29th, Ohio is now taking some steps to encourage others besides first responders, people within the financial sector and a broader range of people to be very careful and aware of signs of dementia and to be able to act without fear of retribution so that we can begin to protect through some policy perspectives as well.
Tim, back to you. One of the unique things I think about St. Mary is you offer service coordination to your senior residents. How does that work and what are the benefits?
Yeah, I mentioned that a little bit earlier. So the service coordinators are assigned to a building, and we have a lot of multifamily buildings, so there might be 50 to 100 residents living in there, and they have office hours, and so the resident can go and talk to them about any issue, and then they will connect them. So they know the ins and outs of healthcare programs. So just to give you an example, we had a resident who received her Social Security increase, and because her income was too high, she lost her Medicaid. So she gets a 2% increase, she loses her health care. And our service coordinator, who knows every in and out, says, do you have a landline phone? And the resident says, no. And she says, well, you can subtract the cost of a landline phone from your income, so get a landline phone and you can keep your health insurance. So they know, I always say it's kind of like the show MASH. Remember Radar O'Reilly? He could just figure out everything. They've done this hundreds of times. We work with over 100 local nonprofits to connect them to whatever they need. Now, the biggest thing, let's get back to that trust level. A lot of home health care agencies or vendors will come in and they'll say to the residents, we're here to help you. And then they talk to them and they say, oh, we can't help you after all. You're not covered. Your insurance doesn't cover this. So you get that repeatedly. And what happens to the seniors is they give up. They say, you told me you were going to help me, but you're really not. So what service coordination does is, what we're able to say to them is, you didn't qualify for this program, let's look at another. Let's find a different way. And we can't always help them, but once you have that trust level, which is so critical, you're able to connect them to services. And what we have found is for every dollar we invest in service coordination, we can connect residents to $3 in services that they qualify for. Now, That's a big deal. If your annual income is $12,000 a year and we connect you to Meals on Wheels that's worth about $1,200 a year, that's 10% of your income. So now maybe you have money to do some entertainment, to pay for transportation. So we're trying to have these seniors get connected to things that they already qualify for, but they're just not aware of.
Now, is that model something that for-profit entities are doing or should be doing?
Well, it's an interesting concept because when Kathy Campbell, our head of philanthropy, she goes out and she talks to different groups, Rotary clubs and things. And every time after one of those meetings, somebody will come up and say, how do I get that for my parents? Because it's so hard to navigate. So we think there is a significant potential to do that, because if you can go to somebody that can kind of help you go through and maybe get approved the first time and not have something sent back because they've done this process 100 times. Retire MedIQ is in the audience. They're a great example. They're a for-profit company. They do a form of service coordination on a limited basis where what they're doing is, if you're on Medicare, they're going to help you navigate that every year, year in, year out. What are the changes? Well, that's a huge help, because oftentimes on our own we wouldn't know what those are. So I think we will see for-profit service coordination. I'm sure there's a lot of families out there that would pay hundreds of dollars a year to have somebody that they could call about any issue and say, well, what about this? Am I seeing this the right way?
Moving on, let's, in what areas do you see housing, technology, and healthcare converging? We'll start with Kate.
That's an interesting question, because I think we also have to think about socioeconomic status and, locations and other things. So, for example, I live in Oxford, Ohio, which is a extremely rural area. And so what we're seeing with some of the housing challenges is, people living on farms, pretty isolated, not really wanting to move into the city of Oxford, which is, all of 8,000 people who are not college students. And so, technologies, things such as, as been mentioned, simple technologies as, friendly visitor calls, making sure that people are able to stay connected, having their service coordination from hospital discharge followed up in a rural area. That's one particularly unique challenge. What happens when they go back to the farmhouse and there's no neighbors and maybe they live alone and people don't know about their well-being. So simple technologies such as a telephone are kind of where we are now. Will we see that change in the rural areas? Most likely where we are, probably not so much in the near future, unless wireless technology changes considerably. So we live in a lot of dead zones, wireless dead zones, where internet's pretty difficult even to get. So I think it's important to keep in mind, if we're talking urban, rural, what socioeconomic status, what can people afford? And as far as just housing in general, though, I think the point about intergenerational housing is certainly going to be a trend that we see in the future, hopefully, or not, if not intergenerational, then multi-cohabitation housing, where even in our rural areas, one could imagine, people coming together and sharing a house as opposed to living alone. And coming up with different living arrangements that maybe are reinvented to prevent themselves from having to leave that. So again, just socioeconomics, I think, is just a big thing, and urban-rural.
Scott?
Yeah, totally agree with that. You start to get a picture of aging based on everything we've talked about, which is you're going to be frail, sick, poor, and living is going to be really tough. What we haven't really talked about, Kathryn touched on it briefly about successful aging and those social determinants of health. And maybe older adults more so than any other age group, they begin to get defined through the lens of their chronic condition. And usually there's multiples of those. But that doesn't have to be everybody, right? And so, interestingly, the International Council on Active Aging has done a lot of work around functional fitness metrics. So if you want to be able to play golf 3 times a week by the time you're 85, you need to do things when you're 50, 60, 70, 80, and so forth. So it goes back to conversations, and also this idea of vocation. My mom's 87 years old, still works at Florida Atlantic University. One of the big challenges for her with her legs was that she couldn't get out of her apartment and go to work. She still drives, fiercely independent. I was down there this summer, and she had fallen, had a head injury, and called her boss at the university and said, "That's it, I think I'm done." And he said, "No, you're not." He goes, "You need to be here, and we need you here." And so those are aspects of aging, and going to what you said earlier about meaningful engagement. So things that are in the home, whether they be technology or services that are brought to the home, affordability is huge. Where you live is critically important, whether that's urban or rural. But that idea of using those things to enable something different, this idea that as you age, it doesn't have to mean decline. I don't know anybody in this room who wants to be worse next year than you were this year. I hate the phrase aging in place. It implies this idea of being static and waiting to die. I prefer to think about thriving where you want, right? And there's no reason why you can't have a better life next year than what you had this year. And so looking for those things that enable the areas of need, like being able to have motion sensors and medication reminders and, you know, smart toilets that can help assess whether or not you have a UTI, that's great. But also eradicating food deserts and food insecurity. ProMedica up in Toledo has invested $50 million to grow their social determinants of health business, to really begin to help older adults see, and people with less means than others, that they can continue to thrive as they age, and those resources can be available. So I just encourage us to maybe think a little bit differently. Yes, all of the healthcare issues, everything that we've all said is absolutely real, okay? But there's also other realities that if we think strategically and really focus on innovation, we can bend that curve. You want to have healthier 85-year-olds? You start with healthier 8-year-olds, right? So we're all kind of in the Band-Aid business, right? We need to make sure we sell really good Band-Aids, but if you want to put us out of the Band-Aid business, grow healthier human beings. So it's a, you know, kind of a top-down and bottom-up approach.
And Ohio, just specifically so that you have the stats, we've been throwing a lot of stats out for you today, but Ohio ranks 50th out of the states in obesity. You probably heard the Robert Wood Johnson report last week, and it was focused, most of the news was coming out about children, but the data behind those, the elders, was particularly grim for Ohio. So we as a state need to be very proactive in that, hence ProMedica's work in this area. There's a lot of money being spent to arrive at potential solutions. But I wanted to hit on another area that sort of ties some of our themes together. And that is, we've talked about the fact that the caregiver decline is going to occur. The number of caregivers per person in need is going to decline simply by demographics, right? Because of our demographic curve. But increasingly, we're seeing very successful models of an aging workforce, making it possible. I loved your mother's example, but having more employers with that mindset, you have a very dependable workforce in an aging workforce. How many of you have a young workforce that you are challenged to find arriving at the same time every day and not expecting a reward? I don't want to malign any generation, but, you know, so the aging workforce is a different workforce, a different group to work with, and finding ways by which to successfully employ a skill set and a group that are going to be a very dedicated group, I think is worth some effort. And that means just like you need to have flexibility in your policies for a young single mom or single dad or individuals at a time in their life when flexibility is key, well, let's have some flexibility for an aging workforce. I think that the theme, I guess, is that we have to approach employment with some different theories on how we're going to engage an active workforce.
Tim?
I guess I would just add that this whole concept about having a purpose in life and a reason to live, we see that so strongly with our seniors. Whether that's a new friend that they have or a volunteer job, when you can have the most affordable housing and the technology and everything, but if you don't have that purpose, and so one of the questions you asked earlier was, what would you say to 30 and 40-year-olds? I would say, invest the time with your parents now so that you're not a stranger coming in later on. Invest in it now, because that's what's really going to pay off. I mean, that's what life's about. These aren't technical solutions. They're our family members. And how do we deal with that? So while there's a lot of technical solutions, it's that one-on-one that makes the big difference. It's whether it's taking the extra time to chat with a senior that lives next door to you, to give them that kind of purpose. And I see that missing a lot of times.
Real quick, there was a lot of mention of like different technologies, be it the toilet. If there's someone out there, is there a resource where someone can go and find a list of these technologies and where to purchase them?
FamilyCaregiverCouncil.com. It's all free. It's hot links it's all categorized by the different types of services. It's not all technology. And you can get a pretty good overview of what's out there. It's going to be interesting. I don't know if many people caught this, but recently Best Buy purchased Great Call. I mentioned them earlier for $800 million. This is Best Buy's second foray into technology, sort of focused into the older demographic. They tried this years ago and it failed miserably. They had some of this stuff in the store, but the people in the store didn't know anything about it. And if you're 78 years old, you probably wouldn't, if you don't know about it, you're not going to wander into Best Buy and stumble on it. I'm very eagerly anticipating their move towards this. Amazon tried it a few years ago. And if you went to the landing page on stuff for older adults, it was every ageist stereotype you could possibly imagine, all on one landing page. It was astounding. Fortunately, they've gotten a little bit smarter about it. But yeah, go to FamilyCaregiverCouncil.com. It's a decent starting point. But it'll be interesting to see what businesses are going to do going forward, Amazon in particular, and especially Best Buy with this acquisition.
There's time for audience questions, a little bit of time. So if anyone has an audience question, please raise your hand. Moving along. If you all had to make, this is a question for each of you, if you had to make one prediction for the future of seniors, housing, technology, and healthcare, what would it be? Tim, we'll start with you.
Well, just to go back and tell you first how housing has changed. So in 1940, the average family size was 3.7, and the average new home built was 1,200 square feet. Then fast forward to 2017. Average family size is 2.5, 31% smaller, and our average new home is 2,400 square feet. So we have 3 times the living space that we used to. I think we're going to see a change back to that. Smaller homes that are more affordable because they're smaller with technology. And just to tag on to what Kate said, these different living arrangements, people coming in and living together, what a difference it makes economically to have 2 people in a household than one.
Just go down the table here?
Yes.
All right. I would say, to piggyback on the Uber concept, that those of us who are in younger age cohort tend to think of what we want and go to Amazon Prime, right? If you need it, you go online and get it. And we have a generation that's not their habit. And I have an example from this past week where my mother, who'll be 98 in January, said, I need to get to Macy's to pick up something. And she described it, and getting to her and getting her to Macy's and getting her back home, not easy. Just going to Macy's myself and getting it to her, easier, but still not easy. And so Amazon Prime, thank you very much, carried exactly what she needed. And I ordered it, and she called me on Sunday afternoon and said, you won't believe what just happened. They delivered on Sunday. And she got the product that she wanted with no effort. And so educating our oldest old on the availability of products in a new way that they've ever had before is just one small step that we could take. But also having Uber and Lyft begin to really put their arms around what they could be doing to serve seniors and really take their ability through the platform that they have to deliver a new set of services, I believe is just going to happen more rapidly than we would ever have imagined. And we haven't mentioned robotics, so that's one piece I'm firmly in the camp of. And the second is we're seeing, because of the fact that other cultures have faced the demographic shift that we're seeing or beginning to see here and have begun to make great strides, robotics actually are not as crazy as you might think. And a decade ago, if you had asked an elder in our country whether they would want to be served through robotics, the answer would have been no, and that has shifted. And we have actually here in our area of Southwest Ohio and Cincinnati, an organization that's working with the University of Cincinnati and making some tremendous strides in terms of robotics, and now we're beginning the use of artificial intelligence so that the robotics are responding to facial responses and facial actions. So it sounds a little far-fetched, but I do believe that there is in the near future some work that could be done that could create some good momentum towards solutions on the robotics side.
Scott?
I'll just kind of piggyback on what Tim just said. I think smaller living spaces, thoughtfully designed, embedded with technology that will enable people to thrive wherever they choose to do it in a way that really begins to allow them to socialize very differently. I'll send you to a website to see what I think the future of this could look like. It's a company called Minka, M-I-N-K-A. Gerontologist by the name of Bill Thomas, who was one of the creators of the Eden alternative, which, if you know what that is, essentially it's why nursing homes don't have VCT tile and metal handrails, along with other whole person and person-centered wellness programming. It's a new venture that he has started, and these homes are, on average, 400 to 600 square feet, beautiful design, about 40% of the cost of an equivalent normal stick-built home. They can be put up in 12 hours, and it's garnering a lot of interest from municipalities around the country who see these potential to develop pocket neighborhoods or cluster them in different thoughtful ways to create aggregate living arrangements. I think that could be really interesting.
Kate?
One thing that we've kind of alluded to but haven't really talked about is ageism, and that applies to housing as well. So, Betty Friedan, back when she wrote The Fountain of Age, talked about old age ghettos to describe how older people are displaced and kind of put out of the way, and in retirement communities that you can't really see and that people don't really interact with folks from other ages. And fast forward 30 or 40 years, we see certainly the baby boomers talk about not wanting to live in kind of age segregated communities for a variety of reasons. So I think what we're seeing, especially in Europe, and the Dutch are really great at doing this, is designing multi-generational communities using universal design so that it's not a matter of I need to move to a place now that can accommodate my needs, but the place I'm living at could accommodate my needs at any level, whether I'm a younger person with a family, whether I have a disability, whether I'm older. And by purposely integrating people of different ages and communities rather than having people age out of communities or being forced to move somewhere else, the idea is that we would stop stigmatizing old age and we could combat things like ageism. I know personally I was invited once to a book club that I did not join, and the first thing one of the ladies said was, "Oh my God, I live in a neighborhood where everybody's old. I wish they would just die and move out." And it's like, of course, once my head stopped spinning, and as my husband said, "I'm glad to see you're making friends." And I gave him a lecture on, but that's the reality, is that there's the old folks home, there's the old neighbor, and I think until we really think about ways of integrating age as a part of a community, and that's a pie in the sky, but I think that's something we really need to aspire to as just a society.
I think we have an audience question here. Is that correct? What is your question?
So I'm Dr. Amy Magnus. I'm at the Air Force Institute of Technology. So we, of course, like mobile coordinated care. That's and so, in fact, we see putting a virtual nurse in a car as really transformational. What are your thoughts on mobile health?
I think it's absolutely brilliant. I was at the American Telemedicine Association annual conference last year, and it was, you talk about ageism. So we're used to seeing everything defined in our country as 65 plus, right? You have your different demographics, and you get to 65, and everybody is exactly the same. You just throw a plus sign on it, and that's it. And we know that's not true. So I was listening to a presentation from a behavioral health company that was using telehealth to do behavioral health services. Brilliant. They segmented out their patient population, and then they had 56 plus with a 0 next to it. And I was with one of my colleagues from our investment banking firm, and her mouth dropped open. I said, just wait for it. It's going to be the digital divide nonsense. And sure enough, the presenter said, well, the reason why there's a 0 there is what we've really found is that people over the age of 56 are not comfortable with technology and really don't present a viable segment for our business model. And I thought, okay, I'm literally 4 years from that. Are you kidding me? So, one, older adults, whether it be boomers who are now 65 or even the older old, are more rapidly adopting technology, particularly mobile technology. There are certain exciting progress that's being made. A company called Forefront Health, one of the most under-resourced parts of healthcare for older adults is behavioral health counseling and access to behavioral health. And it's partly because there's only, I think, 1,500 board-certified Gerontology psychs in this country, which is a stunning number to me. But looking at how you scale these services for older adults using mobile technology, I think is absolutely the way of the future.
And just adding on to that 56 plus, so our senior buildings are 55 and over, and people look at it as one group. So we have parents and kids living in the same building. The son's 60, the mom's 90. And what's interesting about that was you lump them that way. The mom who's 90 says, why do you let all these young people in the building? And the 60-year-old says, this place is like a nursing home. So as we live longer, you're dealing with multiple generations and all the generational issues there. So I think that's a good point as you think about business opportunities. There's a big difference between somebody who's 60 and 80 and 100 and what they need and how they would use technology.
Well, very good. Well, on that note, I'm going to turn things back over to Kathy. Kathy, here you go.
Well, I want you all to join me in thanking this great panel today for being here. We'd also like to extend another thank you to our sponsors who have supported this event today. During the course of the presentation, you heard Tim Bete refer to an important study done by the Bowen National Research Group, and they've put together a report about senior demographic trends in the Dayton area, in particular Montgomery, Clark, Greene, and Miami counties. This valuable study is being made available to you free for being in attendance today. So we would like to encourage you to put your business cards on the center of the table if you're interested in getting a copy of this valuable report. I also mentioned in the beginning of our event that this was our first annual senior summit. We're a nonprofit organization helping seniors, in particular low-income seniors in the Dayton area. And it's our intent to host this valuable senior summit every year. The challenges facing the seniors, as we've heard today, will continue. We're looking at, by the year 2030, to have 80 million seniors in our nation. And so we believe that it's very important for us to continue talking about all of these issues. So if you're interested in participating as a sponsor, a panelist, or just attending again, we would love to hear from you and let us know, because we are going to do this again, and we would look forward to seeing you here again for our next Senior Summit. So thank you for being here this morning. We encourage you to enjoy the rest of your day. Thank you again.